To the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements made to your smile can make a big difference in your life. According to my first guest, he says that it can not only make you feel better about yourself, but change the way people perceive you. We're talking about comprehensive dentistry today with Colorado's dentist, Dr. DiLizia. Dr. DiLizia, welcome to the program.
Thanks for having me.
Now, before we get into today's topic, for people that don't know you, tell us a little bit about your practice. I guess you do just about everything under one roof.
We do. We're a complete care dental office. Our patients expect us when they come into our office to have their whole mouth taken care of. For example, we offer 6-month cleanings, maintenance visits for periodontal patients. We do white fillings, crowns, bridges, dental implants. We can fix dentures. We have a 3D imaging machine to help us with those cases. We have non-surgical laser techniques for periodontal therapy, whitening, which we love to do to enhance smiles, and we also have orthodontics.
You do root canals too?
We do love doing root canals.
You like doing root canals?
I don't know what it is
What about
that.
the poor patient?
You know something, as long as they're gently, carefully made really, really numb, it's usually not so bad for them.
Okay, good. Now, people need to know, you know, this is a dental show. We're talking about how smile can improve your life. But this is your topic.
Oh, yeah.
You have a radio show.
Yes.
I listened to.
Thank you.
Very exciting, by the way. It was
I
good.
appreciate that. Thank you.
And you have a couple of blogs. I thought I'm going to be nice and read a couple of his blogs. And I got hooked on the blogs. And I read at least 7 blogs.
Great.
Right? I spent about 35 minutes reading your blogs.
Thank you.
But they were very uplifting.
Yes.
Is this way you, I mean, this is your whole thing with patients as well?
You know something, one of the great blessings I have is meeting people every day, all kinds of people from different walks of life and different nationalities, different parts of the world. And they're all inspirational to me because I have this profession that I chose a long time ago that I'm so blessed to meet people and learn from them. And I felt it an obligation that I carry that information to other people to inspire other people in their lives. That's pretty much the premise of the radio show, to be honest with you.
Is that what's it called?
It's called The Business of Life, and it defines on different parameters of what success is for different people. I know everybody uses money as a metric for success, but there's such fulfillment and achievement in life that it's exciting to meet people and to talk about subjects that could benefit somebody. I mean, teeth are very, very important. I love them on there, but the success stories that I get from my patients, I just put into my head, and it encourages me, and I want to encourage other people.
How does teeth fit into the success in life, by the way? I mean, you're a dentist. You probably think that the teeth are probably one of the most important things.
It's very important. It's the first step in gaining affinity between people. A beautiful smile is, that is. It tells people you're glad to see them. You're really happy that they're there with you. It increases confidence. There's this trickle-down effect that happens, that when you increase confidence, you're able to talk to people, look in their eye more directly. Your posture changes. You feel better about yourself at that point, and it makes you warm and welcome. It gives that appearance that people can communicate with you and talk with you. They'll get close to you.
Now, in your practice, in fact, you told me on the phone, you see transformations.
Yes, I do.
That means you fix their teeth.
Yes.
Really, and they change.
They change, but you know something? It starts, the fixing of teeth and making a beautiful smile starts with the basics first. You have to make sure the gums are healthy. You have to make sure that the person's bite is stable, so when you do make them nice teeth, that they can chew with them. Teeth that are non-restorable, unfortunately, sometimes have to be removed. You can replace those with dental implants, but you have to have the foundation set up before you really, really put the icing on the cake with a beautiful smile. Okay,
now you have, after dental school, you went through 2-year specialized training in prosthodontics.
Yes,
what is that? And how does it help you in your practice?
Oh my gosh, prosthodontics is all-encompassing in dentistry. You have to know orthodontics, you have to know periodontics, endodontics, which is root canal, oral surgery, and also dental implants. So you are the captain, the quarterback, let's say, on there, and you're able to really guide the patient through all the necessary procedures they need to get total dental care.
But backing up for a moment, this trickle down.
Yes.
You call it a trickle down.
I do.
Like they come in for one thing, then something else.
Yeah. How many times have I had a big burly guy walk in and says, "Doc, I need some back teeth. I just need to chew." And I say, "Great, I can get you some back teeth." And we'll look at their gums, make sure their gums are nice and healthy, make sure that they're stable in every respect, and maybe place in either some bridges or some dental implants and place teeth. Now, the first thing they do is they get that mirror that we show them they're smiling, and they put it in their mouth as far as they can get to see their teeth. And you're sitting there going, "Well, you just said you wanted to eat." And they go, "Well, they got to look good too." And of course they do. If you're spending that kind of time in a dental chair, it should be very functional and it should look really good too.
Okay, good. Now you do, like, you call it like chairside. I mean, some people come in and their teeth are bad, right? Uneven, short, whatever.
Correct.
And you could make teeth right there on the spot and they walk out with what looks like veneers.
Correct.
Is that right?
It is true.
What do you call that?
Well, it's dental bonding is really
Okay.
what it is, and it takes a little bit of an artistic flair to it. A lot of times a person will come in, and we look at these magazines, and we have beautiful pictures in our office too of patients who have gone through veneers and crowns and gum treatments. It is beautiful smiles that we can create. But not everybody needs that. Sometimes simpler techniques to get a beautiful smile are you could use, okay? We have a case here where a gentleman came in and his wife had gotten a reconstruction and loved her smile so much that he wanted something done before they got married, which wasn't too far away. So he came into the office and he had that kind of a smile on there. And something, I agree, he could use a little smile enhancement. So he's getting married. His wife had a cosmetic smile makeover a few years back and loved hers. Took one look at his mouth and said, no, not in my pictures, you're gonna have those teeth.
Okay.
So he's a great guy. He walked into the office and said, I need some help here. I want this taken care of. And I'd like a nice smile for my wedding pictures. And I said, great. So my thoughts started going, all right, your overall health is good. Your gums are stable. Your bite is stable. Things are great. Why don't we discuss? And he stopped me and he said, I'm getting married Friday. Now this is Tuesday. And I said, oh. This is an example of what we can do cosmetically for somebody very, very quickly. A beautiful case of cosmetic dentistry done in the office. This is direct bonding is what it's called, where we actually use a white filling material and reshape the teeth and give somebody a pleasant smile. It's durable, it's strong, and it's really, really fast. 4 hours later.
So like 2 appointments?
1 appointment.
Oh, so that day,
Yeah.
he comes
Well,
in.
he came in, we did our diagnosis on it, and we got him back the very next day because we don't let people wait. And we got him in a chair and did it right there.
Okay. Now, this might get you in trouble on my show, but you said to me, you said you don't like people waiting.
I
If
don't.
somebody calls and they have a problem,
Yes.
even now, what if it's like 4:30 or 5 o'clock? And you got to get out of there.
I don't have to leave because I'm there for people. Our office is there for people. It's not for our comfort, it's for our patients' comfort. Have you ever had a toothache?
Yes.
Okay. How fast do you want that toothache remedied?
Right then and there.
Okay. So whenever somebody calls, whether it's a new patient referred from one of our wonderful people in the office or someone who heard about us, our attitude is, how fast can you get here? What time can you get here? We'll see you. We work through lunch. We're not the type of people who will sit there and worry about eating a sandwich and kicking our feet up. We're there to take care of people.
So your team, they buy into this.
They buy into it.
They know that they may not be off at 5.
They know that, and they know that people have to stay because, like I said, we're there for people. We're there to take care of people.
Now, your wife
Yes.
is also a dentist.
She is.
You guys fell in love in dental school?
We did, actually. Yes, we did.
But you don't work together.
We don't. I guess there's all kinds of personalities out there, and we like having our own separate worlds. And then when we come home at night, we get to be husband and wife, not business partners.
And do you talk about teeth when you get home at night?
At the beginning, we used to, and the kids would look at us at the dinner table, and they'd be like, "What are you guys doing? Can you talk? We have a life too, you know." So when they were young, we decided no more teeth talk at the table.
And I know you brought more photos, but
Yes.
but you say, or the cliche at the top of the show,
Yes.
change your smile, change your life.
Yeah.
And small improvements can change your life.
Sure.
You believe that?
I do believe it, and I believe it because how many times has a person come in and they were unhappy with their smile? We were able to change things. For example, red puffy gums. When you smile and see gums that are red and inflamed,
I've
what
seen
do you
that.
think? Okay, simple treatments. For example,
What is that?
non-surgical. It's either gum disease or gingivitis. Red puffy gums. After some non-surgical periodontal therapy, including our dental laser, which we love using to help people with their gum disease, we're able to correct the gums. They're nice and pink. The smile's better already. Many times they don't go any further. They say, I love my smile. Now, if they don't do anything about those red, puffy, inflamed gums, what'll happen is it'll progress to more severe gum disease, and there's a possibility they could then lose their teeth.
So what, you just kind of clean it out, get rid of the bacterial infection,
We do.
and then the gums are no longer puffy.
no longer puffy, and we also use our dental laser, which really disinfects the area and brings things back to health.
Now, you're a technology guy, you said. I mean, you have a lot of the new things.
I do, yes. We have obviously our dental lasers for non-surgical periodontal therapy that we love using. We have our 3D imaging for placement of dental implants so we can avoid nerves and sinuses and place the implants in the right place. You know that 3D imager also works for root canal treatments too. We're able to find possibly cracks in teeth and not go down a procedure where maybe it's not necessary at that point, where the tooth might be hopeless, instead of wasting our time going through a whole root canal procedure.
Is this the new trend in dentistry, where you go to one dentist and it's all done right there? That means you don't have to go to one guy for this and one person for this?
I would say it is the new trend. You know, the most valuable commodity people have right now, the most valuable resource, in my opinion, are people's time. If you've got kids, they were young, you had to drive them to soccer practice and baseball and dance lessons and things like that. We're really, really busy. And with most households with 2 people working in the household, when they come to our office, when people walk through that front door, and we're so blessed to have them when they do walk through that front door, they know that they can come there and get everything taken care of. They don't have to get driven all over the place. We were talking about toothaches before. If you have a toothache and you walk in the dental office and he says, oh, you need a root canal, you have to go to another office and have the root canal. And they can't see you for a week. What are you thinking at that point in time? I need help now. So
and that happens like all the time in dentistry?
From what I see in dentistry, it does happen. What it does, though, what complete care dentistry and the ability to take care of everything does for us is it really puts the pressure on me, challenges me as a practitioner to keep up on everything, to really do my journal research, to do my continuing education courses and stay on top of everything. So it benefits our patients, but for me personally, it keeps me on top of my game.
Because people don't like going to the dentist, right?
They usually don't.
Do you ever hear that?
If I had a nickel for every time, yeah.
Like, what do they say?
You know, they walk into the office and if they're in pain, they're happy to be there because they want to be out of pain. But they always say, you know, doc, I had a broken leg and I was not afraid of the doctor, but I walked into the office and this tooth hurts and I'm scared to death, is what they'll say to me.
What's your line? Like, what do you say? Hey, no offense. I mean, when they say doctor, no offense, but I don't like to go to the dentist.
Yeah, you know,
do you have a comeback for that yet?
I have 1,000 comebacks for it, and I usually gauge it per person who's standing in front of me. You know something? I usually tell them the proof's in the pudding. We're going to take really good care of you, and we're going to change your mind on that.
And the dental phobics, the people that are really afraid, you turn those people around too?
I do. And you know something? It starts first with building a rapport. It starts with sitting with the patient privately and discussing really what it is and what past experiences they had that troubled them. It's procedures that maybe didn't go so well that are stuck in their mind that I can relieve and talk to them about. Give them some information about. Also, give them some new techniques that we use nowadays to help people through that.
Okay, good. So cosmetic dentistry.
Yes.
It's not just veneers. You say small improvements can make a big difference.
Oh, gosh, yeah.
And you brought some photos.
I do. Cosmetic dentistry is a all-encompassing form of dentistry. We look at teeth as the final product, but the process of getting to a beautiful smile is what's really, really important. The smile at the end obviously is vital because it showcases the final, product of everything we did. A person will come in and they'll say, I don't like my smile, but what is it about their smile they don't like? Are their gums red and puffy? Are the teeth crooked? Do they need some straightening? So a lot of times when a person comes in, we'll start from the basics. Make sure the bite is nice and stable. Make sure there's no gum disease. If there is gum disease, obviously treat it so we can have a stable foundation. And then we'll discuss different things we can do.
So this guy in particular.
Yes.
Right?
This is. You
told me in the green room, you said this guy was really hated his teeth.
He did not like his teeth. He was not going out because of his teeth. He's a young guy. Okay, he's 25 years old.
Not going out because of his teeth?
He did not like his teeth. And he had, you see that picture there, he had some, changes in his teeth. They're different levels. One is longer than the other. There was a lot going on there. And through making sure his gums were first in good shape and making sure his bite was really nice and stable on there, we offered him multiple options. And what I love about this case is that it's complete care dentistry. It includes not only veneers, but it also includes bridge work and it also includes implants in there. And you can see from the final product, he loves to smile now.
It's very nice.
It's a pretty case. It's a wonderful case because he's a young guy and it did change him. You could see him on Facebook now. We're Facebook friends and he's out with his friends' places and he's smiling on. And it's really something heartwarming to see. And on a young person, from a father's viewpoint, very emotional. And people like this patient right here that we just showed the picture on are like a lot of people in Colorado. They're walking around for 5, 8, 10 years with a smile they don't like. How many times have I gone to a restaurant and seen somebody chew and eat and they have the napkin over their mouth and every time they put food in their mouth on there?
You could spot that?
I spot that and it drives my wife crazy, but I'm always looking around for that kind of stuff because it draws my eye to it.
You're out to eat, you're telling your wife, who's also a dentist,
right.
You say, look at this guy, he must have a problem with his teeth.
Yes. Believe it or not.
And you feel like, I want to help this guy.
I do, because I look and you can almost see that person may not have enough back teeth or possibly some loose teeth from gum disease or something like that. Or maybe even dentures that are moving around that we can do something for and help that person. But there's a lot of people like this walking around that don't smile, that have really warm, sincere personalities, but can't let it out because they don't want to show people that they're having a problem.
So, this is not for everybody, obviously. Cosmetic dentistry.
It is for everybody.
Really?
It is for everybody.
Elaborate on that.
It is. When we look at cosmetic dentistry, look at it as having your whole mouth healthy first, and then having the icing on the cake as aligning your front teeth with maybe some orthodontics, simple orthodontics, or possibly some minor gum treatments to get your gums nice and even and pink on there, or some even bonding, some simple procedures. Some of my most wonderful cases, I mean, these are wonderful, the cases that we showed here for the larger rehabilitation, but how many times has a person's life changed? Have they changed their personality when we've done simple things, change some discolored fillings, maybe some whitening, get their gums nice and healthy? They're in the chair. Next thing you know, you hand them a mirror and they're smiling going, that's huge. I didn't realize how big of a difference that was. And it is. So veneers and crowns are wonderful. We do lots of those cases on there, but there are simple things that you can do to make your smile really nice, really fast.
Now you have these clear correct.
Yes.
They're like Invisalign.
Correct.
Right?
Correct. They're clear orthodontic retainer aligners, and they're like retainers. They snap onto your teeth, and they'll take a smile, which maybe is your teeth are beautiful, all right? But they're just maybe a little bit crooked. They need to be aligned just a little bit. It's a simple technique, and it's really easy to use. Randy, when you're 35 or 40 years old, your bottom teeth show. And most of the time, the bite changes and teeth get a little bit more crooked. When our patients come in and ask us, what can we do about this? It's simple. We take some molds and we get them the clear aligners, straighten out their teeth, sometimes as fast as 2 months.
You made a point that when you're older, 40 plus,
right,
it seems like just your bottom teeth show.
Correct.
Is it because the lip is dropping down?
It is. The muscles in our mouth get a little bit weak.
So if you have crooked teeth, because I know somebody like that, all you can see is their teeth.
Right.
I spotted, there's a newscaster in San Diego.
Mm-hmm. Let's use your newscaster as an example. There's this person who looks really good on TV and they have crooked bottom teeth. Where does your focus go? It goes to those lower teeth.
I'm looking at his lower teeth, it's true.
Right. Now, from a health point perspective on there, those teeth, when they're crooked like that, will catch more bacteria, more plaque. You could get gum disease on it. It's hard to clean between those teeth. So what do? We take some mold to the inside of your mouth and we straighten them with a clear aligner. Brings you back to health, which is most important, first of all. Second of all, the teeth are nice and straight. Your viewpoint changes on that person. You look at them differently.
They look more sophisticated.
They do. They look
like
clean.
On national news, you would never see crooked teeth.
You would not. You would see teeth that are lined, because what you want to do is add to the persona of the person, not like take it away and stare at something that's a blemish.
Okay. And by the way, people need to know, I mean, I'm not trying to side with you here or endorse you. But since we talked on the telephone and I listened to your blog, and by the way, if you're watching this, you could go to his website. You've got inspirational blogs. I'm listening to your radio blog, and I've been looking at people's teeth.
Right.
And I'm thinking, why don't they fix their teeth?
I say the
same
same thing.
Do you go through this when you're walking around?
I do. Well, you know, when you're a dentist, you tend to look at things like that. You tend to look at the way people chew, the way they smile, the way they bring their hand up in front of their face when they're talking. And you can see that they're a little bit insecure about something. And that's where the smile portion of complete dental care, of comprehensive dental care and good oral health really comes into play.
Okay, good. You brought more photos. What are we looking at?
I did. There's a lot of subtle changes that we can do in dentistry. This is an example of it where a person had come in and they had their teeth done and they weren't happy with their smile.
This is a good looking smile.
And you know something? She's a lovely lady with a pretty nice smile, but she looked at it from the viewpoint of wanting to make herself happy. When she looked in the mirror, she thought that there was something wrong.
Like, what's going on there?
Well, when we looked at her teeth and we did these measurements, because there's like a proportion, a ratio that we like to use to keep things nice. You don't want a large tooth in a small person or a very small tooth in a large person. It doesn't look very good.
All right.
And with her, she says something is wrong. And after we looked at it, took some photographs, made some molds, and we did a little arrangement of the proportion, we realized that the teeth weren't all the same size. They were off the proportion. So what we had done was we had to remake the crowns on her mouth and make them all lined up so that the teeth were of proportion, meaning that they were balanced out in her smile.
Very nice.
Immediately she looked at it and we put the crowns in her mouth and said, that's it. That's what I want. That's exactly what I want.
So how many teeth did you take care of here?
These were 6.
All 6 teeth?
All 6 teeth, and she wanted this. And I said to her, you know, it looks nice. I said, but I understand what you're saying. And yeah, I can help her with her problem of what was there. What we did was we changed the proportions, which brings your eye to the teeth. And she loved it. At that point, she said, this is what I've always wanted. That's the exact word she used. This represents a story of somebody who had a nice smile but wanted to kick it up one more notch. She actually works in front of people a lot, and she was conscious of the way her teeth looked. Even though to you and I, we may say, that's not such a big deal. If 90% of the people walking around with a smile like that, they'd probably be happy. She wanted it perfect. She had a picture in her mind to say, I want it like this, and we were able to achieve it for her.
So not everybody, I guess not all dentists practice, this so-called cosmetic dentistry.
Right.
Is that right? So what do you look for when you're trying to find somebody? Do you have a bias? I mean, you have the prosthodontic training.
Right.
I mean, what should you look for in a dentist that's going to do it?
Sure, you should look for a dentist who's been trained, who's got a lot of training in all facets of dentistry, all the parameters of
Like,
dentistry.
what do you ask?
Well, you ask them, do you do gum treatments in your office? Because if you can do gum treatments, periodontal therapy, you know that you can keep the gums nice and healthy, because you can have beautiful white teeth, straight teeth, and if the gums are red and inflamed, it's just not going to look very good. So you need someone who can help you with everything. If you have a bite that's unsupported with back teeth, you can place some beautiful crowns on the front teeth. They won't stay there because the bite is not supported. If you have somebody who has TMJ, for example, where the jaw clicks and pops a lot, those teeth are not going to stay in that position.
So there's a lot that goes into this.
It's a comprehensive care process that we go through. The teeth are the end product of it. You have to have a stable foundation, a stable bite.
So the way the teeth come together. When you say bite, it's the way the teeth come together.
It is vital.
Really?
I have a story about that, if I could tell you, on a gentleman.
We have all day. No, I'm kidding. We have a few more minutes
And
left.
being Italian, I can talk all day, so we're going to take it.
Okay.
A gentleman walked in from a specialist's office, and he had 2 implants placed on the lower jaw, had an upper denture, and he went through the whole process of placing dental implants, and he still couldn't eat, which is opposite of what everyone else. When they place implants, I can eat everything and they're wonderful, is what they say.
Yeah.
Well, we had looked and the implants were placed in properly. They were ideally placed. Everything was good about it, except his bite was incorrect. It did not fit the way his jaws came together. What we did was remade the teeth with the bite that fit the inside of his mouth. He was out the door, loved it. I get emails every once in a while. I'm here, I'm eating this, I'm doing that. So how crucial is the bite? It's everything to maintaining the health of your mouth.
Okay, good. So, going into this interview,
Yes.
I'm thinking, because we're talking about cosmetic dentistry,
Yes.
it's all about veneers. But
Correct.
It's not just all about veneers.
No.
It's like
not.
affordable cosmetic dentistry? Like, what can you call this if you had to call it something?
Complete care dentistry,
Okay.
comprehensive dentistry. We start with making sure the person is healthy in their mouth, the gums are healthy, there's no gum disease, decay is removed from the inside
Can
of
they
the
be
mouth.
too far gone? I mean, do they ever go inside and say, doctor, this is the worst you've ever seen?
If I had a nickel for every time I heard that, I would be very,
You
very
do hear
wealthy.
that?
Right? I hear it all the time. But you know something? You have to grant that person the beingness to say that, because they don't feel good about themselves. They don't feel well. Their body is not well. How many times have I done gum treatments on somebody and they said, I didn't realize that I didn't feel good. Now I feel much better because all this bacteria is out of the inside of my mouth. It happens all the time. So with complete care dentistry, comprehensive care dentistry, we make sure that the person is very healthy first. Then we go and address the smile, and it's like the icing on the cake. It just makes it beautiful at the end. Do you have time for one more
Yes.
photo? Okay.
Yes.
This is a wonderful lady in our office who had come in and was just unhappy with her smile.
Pretty good smile.
Yeah,
Looks
but
good.
she didn't like it.
Okay.
See, that's the key.
What didn't she like?
She came in and she says, there's something wrong. I just don't like the smile. I had all this work done and I don't like the way my teeth look. I want you to look at her teeth. And then you'll look at, your eyes are drawn to her gums. Okay? And it's the frame of the smile. You can see that the gums are red and puffy. What we had found out with this young lady is that she actually had an allergic reaction to her crowns.
Interesting.
She had come into the office from other specialists and they had said, we don't know what to do because there's no evidence of gum disease, yet the gums are red and puffy. Well, we got our laser, took care of the gums, brought them back to health, remade the crowns, and now she cannot stop smiling. But what we did, though, was bring everything back to health first. And then we were concerned about bringing the smile. And it's easy to make a nice smile when the mouth is healthy.
Okay, so this is the after. Yeah, very nice.
Yes.
So you just, contour the gums with a laser? What do you call it?
We actually, we contoured the gums with the laser. What we actually did was remove the bacterial inflammation because of the reaction to the crowns. She had a true allergic reaction to the material the crowns were made of.
So you just gave her, better materials.
We did. We used a material which was compatible for her that did not elicit an allergic reaction. But this is common with a lot of people. You ever seen someone smile and they get that little dark line at the gum line of a tooth? Right at the tip like
seen
that.
that.
And a lot of times they'll go to smile and they'll put their hand over their face or they'll hold their lip down so you don't see it. I mean, that
So
really,
what is that?
That little dark line.
You see the gray line,
Yeah,
yeah.
a little dark line is an older style crown that had a metal substructure to it. And the metal's starting to show because the gum receded. It used to be tucked under the gum. Now it's not there anymore. We don't use that anymore.
Now you offer like sedation or nitrous.
We do offer nitrous.
Do a lot
I
of
know-
people like that?
I know you're familiar with it and you
I
enjoy
love
it.
it.
Yeah, it's
love it.
wonderful because it relaxes the person. It brings the apprehension down for them. So when we get through the procedure, it's easier for them, much more calming.
We have a lot of medical doctors on the show. We have
Right.
dentists on the show. In fact, you said you've been watching my show secretly for
Many
many
times,
years.
many times, yes.
But I have dentists that say, well, we don't need sedation or we don't need nitrous because we're so gentle.
Right.
But I'm thinking without nitrous, I would no way want to do any of these things.
And I'm sure they're very
What are your
gentle.
thoughts?
I'm very sure they're very gentle. I'm positive I believe that, okay? But I also believe that you have to take it from the person's viewpoint, not your viewpoint. If a person says, I'm scared, I'm afraid, or I've had a bad experience before, my job, our team's job, is to relax that person. And if we can get them in the chair comfortable, they'll tell people about it. It's easier treatment for them. It's just the right thing to do.
And you give great injections, supposedly.
I do.
That's right.
I work really, really hard on that.
Like the no feeling, I mean, it doesn't really hurt.
I work really hard on it. It is such an entranceway to gaining confidence. A person really has a lot more trust and confidence in you if you can deliver anesthetic really gently.
Is there a chance if I went to you, I wouldn't even know that you just gave me a little injection?
There's a big chance of that because that's what I pride myself
Now,
on.
is this true? You told me this on the phone.
Yeah.
That your wife, once a year,
Yes.
injects you.
Yes. She's a dentist, by the way.
But why?
Let me
But
clarify that. Yeah.
Just so you can, you say just so you can
Yeah.
know what it's like.
Yeah, empathy. I mean, you have to
You
put
really
yourself.
do this?
I do. I know. I have issues, but I understand that. I do it because what it does is it keeps me anchored to what that person's really feeling. If you've had that feeling of being numb or your lip is fat, you can empathize with the person. Though, yeah, I know what that feels like on there, but we're going to get you through this procedure gently and carefully, and you have that ability to communicate with real honesty to the person because you know what it feels like because you just had it done not too long ago.
We are out of time. Final message. Somebody watching this, maybe they want a smile makeover, or maybe they haven't been to the dentist in 16 years, but they don't like their teeth, or maybe they're in pain. But for whatever reason, they're not going to the dentist. What do you say to them?
Well, we'll invite them into the office. There's no charge for a consultation and to sit down and talk with us. Meet our team members, meet me, and let's address what really you're feeling. Are your gums red and puffy? Can you chew properly? Are you maintaining your health? Do you like the way you look, your presentation to people when you go out in public? And just talk privately about things so we can warm the person over and really have them come into our office and get great dental care.
We're out of time. I want to thank you for coming to the show.
It's
Great
a pleasure
stuff.
being here. Thank you.
Great stuff. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez.